Minister for Education.
I thank you, sir, and I was pleased to support the suspension of standing orders earlier that enabled the member for Ghana to effectively withdraw what was an utterly inappropriate, grubby almost motion that he had put on the notice paper, and instead offer this motion, which is entirely more suitable. And
there's a point of order.
Unparliamentary language directed at me.
Unparliamentary language.
I want to hold up the House, so I withdraw the word grubby. I congratulate the member for Ghana for introducing, in the place of his original motion, an entirely more appropriate motion, a motion that I think does some very important things, and a motion, given that we received his proposed amendment about half an hour ago. It was late notice, but I have had a chance to look at his motion before he introduced it, and I thank him for giving us that half an hour's notice that we would be debating a different motion.
Minister for Education, if I could interrupt for a minute. You've indicated that you'll be amending the motion. Would you like
I'm about to indicate that, but I haven't yet indicated that.
All right, and you'll be talking through.
So I'm still talking on the motion as introduced originally, therefore I want to congratulate the member for Ghana for adapting the motion, giving us that hour to have a look at the proposed change. We agree with most of it, but I do think that in the spirit of us this morning improving on the original motion, we have a particularly important further improvement to make, because while the motion as introduced does pay appropriate tribute to all of the public health staff, all of the staff in our hospitals and our healthcare system, the doctors, the nurses, the paramedics and the other health practitioners, I think that it would be remiss of this House not to particularly note at this time, given that public health messaging, the way that the people of South Australia have done the right thing, and they have been led to do that right thing, particularly, I think, through their trust in the messaging that they have received from the leadership in health, from the government, and particularly from Professor Nicola Spurrier, our Chief Public Health Officer, her Deputy Chief Public Health Officers and their teams, to congratulate them for that as well. We are a week since we had our last positive transmission of COVID-19 here in South Australia, and we also note that there are a number of the things that are called upon in the original draft of the motion from the member for Ghana to note that some of those things have taken place. So therefore, I seek leave to move an amendment by adding a new paragraph B as follows in the text below, by renumbering the existing paragraph B as paragraph C unamended, as indeed paragraph A is unamended, and by renumbering the existing paragraphs C and D as D and E with minor amendments as follows in the text, so that the motion should now read. And I hope that this is a motion that every member of this House, every person in South Australia can get behind. That this House expresses its appreciation to the talented doctors, nurses, paramedics and other health practitioners and staff for their work in the response to the COVID-19 pandemic. B, notes that it is now a week since South Australia has recorded a positive test for COVID-19 and thanks Professor Nicola Spurrier, her Deputy Chief Public Health Officers and her team for their world-class public health leadership so far during this pandemic. C, recognises that the public health and hospital system is a critical factor in the protection for South Australians and that the system should always be well-resourced and funded. D, notes that the government has provided protections such as personal protective equipment to these hard-working health staff through the pandemic. And E, notes the government has provided necessary resources to our public hospitals to look after all patients in a timely and effective manner during this pandemic and will continue to do so. Sir, the fact is that the COVID-19 pandemic has presented challenges to health systems around the world which many have struggled with to the point of breaking. And in SA Health, we have a system that we did not want to see any of the images that we saw overseas happen here. We did not want that for our community, and we certainly did not want that for our frontline health workers who put their lives on the line around the world, who we have joined with people around the world through electronic means in recent weeks to support those systems around the world, particularly that have been in dire need, stretching to collapse. I think that the extraordinary footage we've seen from Italy, from the United Kingdom, from New York, from other jurisdictions around the world has absolutely caused enormous anxiety to everyone here. And it was critical from the government's point of view that SA Health and our health workforce be given every support they needed to ensure that couldn't happen. That's why we've put in place significant measures to increase PPE, the use of which has gone up dramatically in recent months, the production of which is now coming back to South Australia. The announcement that Detmold is retooling to be able to produce millions and millions upon millions and millions of items of PPE is an example of the government in South Australia working with private industry in a way that doesn't just support our health workers here in South Australia, but will support health workforce more broadly around Australia through that capacity. And that will be a capacity that will continue. Nicola Spurrier and her team and the hospitals have been working hard with the health networks to ensure that the use of PPE is absolutely available and appropriate in the necessary way. But to deal with the potential need for increased capacity, the government's done a range of other things. We have indeed secured the old Wakefield Hospital site, which was an important measure that the government was able to take with SA Health to ensure that should the peak hit in a way that required significant extra capacity, we would be able to do so, and it would mean that not every hospital in South Australia was necessarily needed to have COVID patients, so you could have some COVID-free hospitals. That was an important part of the mix. We've been able to reinvest further funds in reactivating the REPAT in a way that would enable some of those wards to become available should the COVID pandemic peak hit in a way that needed extra capacity. And that is something where I think if we'd been debating the original motion, would have been an issue that would have been touched on several times. The fact this government has saved the REPAT and is now able to reactivate it in a way to help our fight against COVID-19 has been tremendously important. There's a range of other hospitals that have bed capacity if there is a flex needed in COVID-19. Thankfully, we have a small number of people currently hospitalised with COVID-19. We only have 2 in ICU, and for those 2 it's a very difficult scenario, and it's a tragedy that the 4 people who have passed away have passed away. But compared to what we've seen in other jurisdictions and around the world, it is relatively good news compared to what might have been the case. How have we got there? Look, there's a number of factors that are in our favour. There are things that the government has done, such as requiring a 2-week quarantine of anyone coming into South Australia. There's things that all governments have done through working with the National Cabinet collaboratively with other states that have been tremendously important. And I think that across Australia we're seeing the benefit of those changes. But particularly the messaging that the people of South Australia have taken up. This is a motion that indeed every South Australian can take credit for, with the introduction of the new paragraph B that talks about the public health messaging led by Professor Nicola Spurrier and her team and her deputies. That is something that they've reached out to the public, and the public have embraced the capacity to do social distancing, embraced the capacity to practice strong hygiene habits. They've embraced the capacity to work from home where possible, particularly when there was a heightened level of risk of community transmission. We celebrate the fact that it is 6 days in South Australia since we have had since we've had any positive diagnosis, and that it is well over a month now since there's been an example of untraced community transmission. That's a credit to the fact that we are testing. Our testing regime is the best in Australia, and Australia's is pretty much the best in the world. More than 54,000 tests in South Australia. We've had a blitz that we're currently underway with, and since the beginning of that blitz, there has been not even so much as would fill a hand number of new cases identified. The contact tracing team has been a spectacularly important part of the work as well, and that is also led by Professor Spurrier and her team. The way that they have been able to identify the networks of all but 7 and found the epidemiological first cause of where that transmission has come, usually from overseas, some from interstate, many from cruise ships indeed, and the way that we've been able to get on top of clusters such as the Barossa one. And I'm so pleased. Schools in the Barossa and businesses in the Barossa are reopening today after the period where that cluster was expressed as a concern. They've gotten on top of it and they're doing well. There's always going to be more that we're looking to do, and health is a complex and large area. The government is working hard and has been working hard. It was pleasing to see improvements through our health system, improvements in terms of the supports where they needed to be, even prior to the COVID crisis. It was pleasing to see a number of the issues left to us by the legacy of the failed Transforming Health experiment starting to subside even before COVID-19. Our job is to keep South Australians safe. The government's doing it, and our healthcare professionals, all of the workers identified in this motion, deserve every credit that we give them, and we thank them for their work.